So I used to think that medicine had all the answers. Oh, is that true? No, I was taught to believe that medicine had all the answers until my patients started to teach me that medicine was completely missing something. With patients with anxiety and fatigue conditions and pain conditions, I realized that medicine didn't have the answer. And it was through working with patients that I learned a whole different approach to health. These symptoms weren't happening randomly, or to even say that something was broken within the person, which is pretty frustrating when, as in medicine, you look for the physical cause of symptoms, the problem. But they weren't any. And what I realized is they were messages from the body itself. And I'd like to share with you a little bit of my journey through that today. I suppose the turning point was sitting across from more than one patient, but certainly I remember one in particular sitting across from them. And they had been extensively investigated and seen by psychiatrists and psychologists, and had all the blood tests, scans, etc. Although scanning was pretty limited when I was a doctor back in those days. But anyway, they had a whole array of tests done, and they showed nothing. But this person was clearly unwell, debilitating fatigue, exhausted, in pain. Nothing made any sense. And this started to get me to look for an answer, really. I mean, medicine looks for physical problems, psychology, psychiatry looks for evidence of wrong thinking and tries to train your brain to think differently. None of these things actually worked, certainly not in the long run. So you'd have perfectly cheery people going about their life feeling absolutely dreadful. Now, what I started to do was to break this down, and this is going to sound really simplistic, but I thought, well, when our body produces symptoms, our physical body, there is a message behind the symptoms. So simple examples would be physiological ones like, I am hungry. Well, if you eat something, thereby respond to that message, the symptom of hunger stops. And I thought, well, let's apply this to fatigue or pain or anxiety. Anxiety was slightly trickier to begin with, but certainly with fatigue. So I knew that this fatigue was not telling them to rest, because people were going to bed and staying there for a very, very, very long time and showing no signs of recovery whatsoever. They were pacing themselves, taking it much slower than they had done before, and trying to build up this imaginary bank of energy that you have to use. And none of it really made any sense until I started to realize that perhaps a missing part of it was that our body actually has a consciousness of its own, which lives without the head. Now, this obviously went absolutely against everything that medicine or psychological intervention was teaching. And I didn't really care. I went with it anyway because it made sense to me. Because these people were experiencing symptom increases at times where the only difference could be that they had had an emotion that they weren't aware of. Therefore, it couldn't have been created by thought. It cannot be changed by thought. And this is what I call body consciousness emotions, or primal emotions. So when I started honoring that these signals were from body consciousness, or what became known at the time as just the body, things started to fall into place. So instead of me trying to fix people as if they had something broken or wrong with them, I started to encourage them, along with myself at the time, because I didn't know an awful lot about it, as to how body intelligence or consciousness works. And this is where things started to make even more sense. And what was happening was it became obvious that when symptoms were produced, it was actually the result of an emotion having arisen at that time and caused symptoms to increase. And I got out my books and I went through them all, and I thought, well, the only thing that makes sense is the hypothalamus, which I knew about because it was spoken in terms of hypothalamic pituitary axis occasionally in medicine. When I was learning it, they spoke about that. But no one really looked at the hypothalamus in detail. And as I looked at it, I thought, this thing just controls everything. Our immune system, our metabolism, our temperature, our autonomic nervous system, therefore it affects blood pressure, etc., etc., and explained all the symptoms that if this was not working, then that was why people were getting symptoms. So with this realization that these weren't psychological problems, they were not created by wrong thinking or the need to alter how your brain responds to the world around you, because it didn't work. It worked to a point, but unless you actually got down to root cause, which is for me that these problems are what I've called energy disorders. They are to do with the emotional energy produced by your body and its response to the environment that you walk through in life. And understanding that allowed me to realize, well, then nothing is actually broken. It's just that the people with these symptoms just need to learn a new skill. And that skill I developed into the whole process of Mickel Therapy, which is about rekindling your relationship and understanding of how body consciousness works. So if you're interested in learning more, I encourage you to subscribe, please. Yes. And also you might want to check out the website and have a look at the course that we offer. It's an online course that you can have additional coaching alongside it with. I'd be interested in any of your questions below that I'm happy to answer personally. Next time you get symptoms worsening, just ask yourself, what is my body really trying to communicate with me? What's it trying to say about this situation that I'm in right now? And look for an emotional answer. And this is not one that comes from your head, though, remember. Body consciousness works out with your brain. Anyway, I hope some of that made sense. Thanks very much.